Awesome. Thanks so much, Marc. I am Marc as well, but I spell it the French Canadian way. I'm an emergency physician and founder of Mach32. And realistically, I want to stop patients from bleeding to death. There's a saying in emergency medicine, all bleeding stops eventually. So it's our goal at Mach32 to make sure that that bleeding stops while the patient is still alive. Most people don't realize it, but traumatic injury and bleeding are responsible for 9% of worldwide deaths. And hemorrhage is the #1 preventable cause of battlefield death for our armed forces. It's kind of interesting that we are following the company with the slow motion gunshot video. This is a very preventable cause of death that we can address. Men are stupid as well. We take risks. We ride ATVs and motorcycles. Again, the previous company. And traumatic injury is the #1 cause of death for men under 45 in North America. And then finally, over 200 women bleed to death every single day in the developing nation. This is something called postpartum hemorrhage, and we can impact that. There's an easy solution. It's a medication called tranexamic acid. This is a generic drug that's been around for decades, but there's a problem. It's an intravenous drug, and it's hard to give. In a military population, less than 5% of eligible patients get this drug before reaching the hospital. But there is a strong correlation with time of delivery and efficacy. The faster you get it, the better you do. All that we're doing is enabling more people to deliver this medication faster and easier with what you can consider an EpiPen for trauma. We are injecting this IV drug into the muscle to save more lives. And we know it works. It's been tested by the Canadian Armed Forces, Defence Research Development Canada. We're therapeutic in an animal model in under 1 minute. Consider how long it would take to even start an IV in an austere setting. We have a longer half-life than an IV administration as well, and the military is quite interested in what we're building. Now, this is a drug-device combination. We are focusing our IP as well as our regulatory strategy on both the drug and the device. We have IP filed around our novel high volume injector, around our proprietary concentrated TXA formulation that you need to inject it into the muscle because it is a large volume drug that we have concentrated, as well as the pharmacokinetic profile that you get from using an auto injector with this drug. Now, as a drug, it will be regulated with a new drug application, but we've already met with the FDA, and this drug is in major trauma protocols, including tactical combat casualty care and advanced trauma life support. Our first pre-IND has been submitted, and we're prepping a second pre-IND with financial support from BARDA. Our plan is to leverage the current safety and efficacy data. We know it works, we know it's safe, and pursue a 505(b)(2) pathway, which is analogous to a 510(k) pathway on the device side. Now, massive hemorrhage, massive problem, massive market. Total addressable market is over $4 billion in the United States with professional use alone. Our goal eventually is civilian use. And we know the civilian market is orders of magnitude larger. If you consider there's 14 million postpartum hemorrhage cases every single year, that's 14 million cases that the World Health Organization says should receive TXA. We can help that happen. Now, our goal in the end is acquisition, and there's been many acquisitions within similar spaces that we can discuss as we move further. Our go-to-market strategy, we're starting with people who want it, and that's the military. We have on record a senior UK colonel stating he wants every deployed soldier, sailor, and airman to carry a TXA injector. From there, we're going to move into first responders and finally civilians. We're working with some great government organizations. The key one I want to focus on is BARDA. We've just signed a $750,000 research and development grant with BARDA, which is very exciting for us. Now, you've met myself in the breakout room. You're also going to meet my co-founder, Kelly. This is her third medical device startup, and she's already commercialized a device that is in use by the US Armed Forces for hemorrhage management. Now, what are we doing? Obviously, we're raising funds. We have a small raise to help leverage that BARDA contract. This is an opportunity, and we're motivated to close quickly because the quicker we close this, the faster we can move on to further larger grants. So we have $750,000 from BARDA. We're raising $500K with 100 already in, 6.5 million pre-money cap, 20% discount on a convertible note. So this is your opportunity to help stop patients from bleeding to death and get in early while we have the momentum. Thank you.